Yes, so Mastercall Healthcare evolved from the Stockport Doctors Cooperative. So in 2004, when it was GP opt-out, the responsibility for out-of-hours services became the PCT, which is now the CCG, the Clinical Commissioning Group. So that was the transition from Stockport Doctors Cooperative to Mastercall Healthcare. Predominantly, we were an out-of-hospital provider, so when the GP surgeries closed at 6:30, the practice managers handed me their key, and we were custodians of the care of those patients until 8 o'clock the next morning, and we handed the care back to the GPs. So that is fundamentally the out-of-hours service. But we have also evolved and diversified the range of services that we provide. So we provide a range of out-of-hospital services now rather than just the out-of-hours service. So the most recent is the community intravenous therapy service. So this is an amazing service. We have fantastic feedback from the patients that use the service, and it's about providing IV antibiotic treatment in the patient's own home or here in the treatment centre where that's appropriate to do so. So instead of patients having to sit in a hospital bed to have their intravenous therapy, they can be in the comfort of their own home, or where they're mobile and well enough to come to treatment centre, they come here. So it's much better for the patients, and obviously they're not taking up a hospital bed if it's not necessary. We also provide a walk-in centre in Trafford, and we have a registered practice ourselves with 4,700 patients. So we're very close to primary care and what primary care needs. We also provide a service called ATT, Alternative to Transfer. This service is in collaboration with NWAS, the North West Ambulance Service. When an ambulance crew arrive on scene, they will do a pathway assessment of the patient, and if it's deemed that the patient doesn't require transfer to hospital but does need a medical intervention, they will pass the call to Mastercall, and our team of GPs and advanced practitioners will respond to that patient, and that has a successful deflection rate of 93%. So 93% of those patients would otherwise have been transferred to hospital if the service wasn't there for them.